Hello, and welcome to the Empowerography podcast. This is a platform created for women's voices to be heard and a place to share their stories, journeys, and successes with the world for the purpose of helping other women who might be on similar journeys. We are empowering women one episode at a time. I'm your host, Brad Walsh, so kick back, grab one of your favorite beverages, and enjoy the stories. If you've ever felt like your voice didn't matter, like your story wasn't worth sharing, you're not alone. At the Empowerography Live in-person conference this year, we brought together voices from around the world, women who chose to stand up, speak out, and share stories that changed lives. And here's the truth. Your voice matters too. If you've ever felt that pull to share your story as a guest on a podcast, to start your own podcast, or step into your power, this isn't random. It is your invitation. Head over to empowerographypodcast.com and see how you can turn your voice into impact, because your story isn't just yours. It's someone else's survival guide. Hello there, Brad Walsh here, your host of the Empowerography podcast, a platform that was created to help elevate and amplify the voices of women through sharing their stories. Today, my guest is Kelly McCann. She is a triple board certified physician in internal medicine, pediatrics, and integrative medicine, with additional certifications in functional medicine and medical acupuncture. She's also the founder of the Spring Center in Costa Mesa, California. Welcome, Kelly. How you doing today?
I'm great, Brad. How are you?
I am wonderful, and I am so excited to have you here. We were just saying before we jumped on, it's been a minute since we've seen each other and connected, so I'm very excited to have you here and looking forward to jumping in and sharing about all the beautiful light you put out into the world too, the incredible work you do to help people, and a little bit about your story and your journey. So with that being said, let's get this party started.
Sounds great. Let's go.
So I guess let's just start at the beginning, Kelly. What led you into this field of work? Why medicine?
Why medicine? That's actually a really good question. That was not my thought when I was growing up. I wanted to be an opera singer or something like
Really?
that. Yes. Yeah. I studied music at Brown, and I had a voice teacher at New England Conservatory, and would drive up or take the bus from Providence to Boston to study. And then at the end of my junior year, I realized, okay, I don't really want to do this. This isn't quite my passion. I don't want to be spending 6 hours a day in a practice room. So I had to go. I graduated and then had to figure out what I was going to do with my life. I worked for a book publisher for a little while, went and got a master's in library science, and then thought, I really like the mind and the brain and why it works. And I was always interested in spirituality. So I decided I was going to go back to school for neuroscience, and then realized, oh, that's 3 more years of undergrad. I just don't think I can do that.
I don't have it in me.
So I did pre-med, thinking I could get to some of this stuff that I was interested in that way. And then I got into medical school. But along the way, I was studying meditation with an acupuncturist, and I really wanted to go to acupuncture school because I just loved the much more holistic way of looking at the world. And my parents said, oh, Kelly, you should really think about going to medical school. And I said, okay, if I get in, I'll go. And if I don't, I'll go to acupuncture school, and I'll be so excited. I got into 4 medical schools. So I said, okay, I get the message. I gotta go.
But all the while, you knew from even before that you wanted to go the more holistic and naturopathic route or natural route.
Yes, I did. And I had even applied to an osteopathic school in New York, and I got in. But the call of New Orleans and Tulane just was too great.
So I'm curious then, how difficult was that for you to sit through classes and studies and all of the things for Western medical school when your heart really wasn't there? It was more on the other route, the Eastern route. How difficult was that for you?
It was very painful. In fact, I had a boyfriend my first year, and when I came back the second year, he was like, you know what, Kelly, I wasn't sure you were going to come back because I know how hard it was for you.
Mm-hmm.
Yeah. And I made the best of it. I took public health classes. I found a medical acupuncture physician and spent some time with him.
Mm.
I did massage classes and Reiki and healing touch. So I did as much as I could to continue to foster that interest in holistic medicine, and made it through medical school. And the same thing with residency. I found the most open-minded residency program director that I could, Donna Holland, in Phoenix. I did med peds, right? So I did an internal medicine and pediatrics residency, which was 6 years essentially of residency training packed into 6 years packed into 4, right?
Wow.
So it was a very intense time. And I didn't really have time to question much of anything. But when I finally graduated, I was so elated because I was free finally to be able to study what I've been waiting to study.
The chains and the shackles are off.
Thank God. Yeah.
So having been trained in some of the most rigorous, as you just explained, medical environments in the world, when did you first realize that the model you were taught could diagnose disease, but wasn't actually explaining the suffering that people were going through?
There was this aha moment, I think sometime in residency, when I realized the structure and the way that we think about disease is, from a physician's perspective, is, okay, what are the symptoms that the patient is presenting with? And then what's the differential diagnosis, right? This was always the most important thing. What is a differential diagnosis? That means, what are the lists of possible diagnoses that these symptoms can line up with?
Okay.
Right. And then once you have your list of diagnoses, then you know the list of lab tests and radiology procedures and things that you need to do in order to make your official diagnosis. And then you know what to do, right?
Yeah.
If it's hypertension, you give them an antihypertensive. If it's endometriosis, you take them to surgery and you have endometrial surgery, whatever.
The simple question of why.
The most important burning question that every single patient has is, why? Why is this happening to me? What is going on? And it is the most important question that medicine doesn't ask ever. Doesn't care. We don't care, right? We don't care why. So that's the biggest problem with Western medicine, is that there's no space in the diagnostic paradigm to ask, what is it that's unique about these individual people, their genetics, their lifestyle, their exposures, their personal beliefs, their trauma histories that lead them to this point.
Okay, since Western medicine doesn't get to the root of the problem, I want to dive in a little bit to the root of this problem. Where do you see the problem? I've had many conversations with women that are working in the field that you're working in, and a lot of them have said that it starts back with the education system and what the potential doctors are being taught. So I would love to hear your thoughts. Like, where is the root of this, and do you ever see this changing in Western medicine? I'm curious.
I'm not sure if it will change in Western medicine. And yeah, we could point to the education. I think it's much deeper than that. I actually think, and this is where we get into some of the work that I'm really focusing on now, is that the paradigm for our understanding of health and healing is faulty, flawed. So we have this idea that if I have a physical problem, I go to the medical doctor. Right? Or the chiropractor, or some sort of healthcare practitioner who focuses on the body. If I have a psychological, mental, emotional problem, I go to my therapist or my psychiatrist or whatever. If I have a spiritual problem, I'm going to go to my spiritual guru, my yoga teacher, my minister, my priest, my rabbi, somebody who deals in the spiritual realm. Human beings are all three all at once, right? We can't separate the mind, the thoughts, the spirit from the body. Not really. We try. And what Western medicine has done is to put systems in boxes. So now you have a cardiologist for your heart, and a gastroenterologist for your stomach, and a nephrologist for your kidneys, and a pulmonologist for your lungs. And maybe if you're lucky, your PCP can look at all of those things, or at least write referrals to each of those specialists. But right, it doesn't work. the whole system is completely broken. And the therapists, when we're talking about the mental emotional piece, they're not paying any attention to the body. And you can't just think that we are so much more than our minds. And I think that this is what the book, The Body Keeps the Score, is about, right? And yet, I would offer that still comes at the situation as there's a problem that needs to be fixed kind of paradigm. And what I'm suggesting is actually even further beyond that, which we can get into.
Yes, I would love to. Please. Everything is so siloed, as you're saying. If I can just say one thing, something you said, that it's so broken. And I said that to someone probably about 2 or 3 years ago, someone who's doing the same work as you are, similar work as you are. And she said to me, no, it's not broken. It is working exactly how it was designed to work.
That's true. And the only way that it's going to change is if we accept that it's not working. It's broken. And just because it was designed to work that way doesn't mean that we should keep it.
No, absolutely not. It needs to change. I think, honestly, I think when we talk about healthcare or sick care, whatever you want to call it, the education system, all of these systems need to be burned right down to the ground, to the foundations, and started again and built right up the proper way, and the way that is going to serve humanity better, period.
Yes, I agree. And so does the astrological signs these days, right?
Yes. So please dive in a bit deeper. You said you could go a bit deeper. Huh?
Sure. So I work with complex chronic illness patients, which means they have multiple things going on with them. And in functional medicine, we're looking for what's considered the root cause. So we actually ask why, right? And usually the answer why is still in the biological realm. People are mold exposed. They have infections like Lyme disease. They have environmental toxicant exposures like mercury and plastics and all these things, right? So these are your silos of buckets of the root cause. But we're all on this planet. This planet is toxic. Many people have these different infections. Why are some people affected and others are not? Why are some people horribly disabled from chronic illness and many people with similar exposures are not? What is the root of the root cause?
Care to elaborate?
Sure.
Please do.
I would love to.
Yes.
I would love to. So I do have to tip my hat to Don Miguel Ruiz. Are you familiar with him?
Yes, the Four Agreements, right? Yes.
So I think I've listened to that book 20 times. And the whole idea of we come in as whole humans is so resonant for me. And then what happens to us is that because have you ever met a baby who's not really happy except when they're hungry, tired, or have a poopy diaper, right? No, that's what happens. They're whole humans and they're expressing their emotions. And what happens is that we're taught this is what it means to be a good girl. This is what it means to be a bad boy. This is what it means to be a good husband, whatever. Children should be silent.
Seen and not heard. Yes.
Exactly. Boys can't cry.
Yeah.
If your emotions are too big, that's not okay. It's not okay to express your anger. It's not okay there's so many rules and expectations put on us by our hopefully loving, well-meaning parents and siblings and teachers and the society, the culture. We're taught how we're supposed to be, how we're supposed to fit in. Every single one of those things is a piece that causes us to forget who we really are, right?
Yep.
And so what happens is all of these things come on and they cover up who we really are, who we're supposed to be. And eventually we have all these coping mechanisms to get love, to be okay in the world, to follow all these rules that we've taken on from our culture, our family, etc. And at some point they don't fit anymore. And that's when the symptoms show up. Because essentially the body is the voice piece
Mm-hmm.
of the soul.
I love that.
Thank you. Thank you. And the soul is saying, hey, time out. This isn't in alignment with who you really are. It's time to wake up. It's time to pay attention. It's time to shift and let go of those things that no longer serve you anymore because they are not who you are. And here's the beautiful piece. The body shows us these places in sensations and symptoms. The more symptoms we have, the further away we've strayed from who we really are. And what that also means is that the body's not the enemy. It doesn't need to be fixed. The symptoms aren't the problem. Our answer to the symptoms is to suppress them, to medicate them, to ignore them, to override them, to push ourselves further and harder, to be angry at them, right? So everything that we're trying to do in Western medicine and even functional medicine is all about fixing the symptoms. And what I'm proposing is that the symptoms are actually the messages from the soul saying you're out of alignment. And not only that, the symptoms line up with how we need to shift, how we need to allow ourselves to be who we really are. So for example, if we have thyroid issues, which is very common for women, right?
Yep.
What's there
Your
underneath
voice.
your thyroid? Your voice,
Yes.
right? If we're not expressing ourselves authentically, it's going to show up. If we're not connected between our head and our heart, it's going to show up in our thyroid, right? It's a very simple example.
Correct me if I'm wrong, but really what you're saying, the overarching thing is start listening to your damn body because it knows. And second of all, it's a matter of remembering who you were. Those are the two things that really you're elaborated on, but that's at the root of it, is those two things. That's what we need to do.
Yes. Yes. And start with, if you have a really antagonistic relationship with your body, start with a little bit of curiosity. Is it possible that my body is actually speaking to me? Is it possible that my body is actually on my side? Start with there. You don't have to believe what I'm saying. Start with the question and see if that resonates for you. The patients who I see get better, do this deep dive, do this really hard spiritual work because they recognize that things are out of alignment for themselves. I have patients. I had a woman who came in a number of years ago. She was so debilitated by her POTS, postural orthostatic tachycardic syndrome, that she had to lie down on my couch. And I am not a psychiatrist, right? She had to lie down on my couch the entire time because when she sat up, her heart rate would shoot up into the 140s and she couldn't perfuse her brain. So she couldn't actually have a conversation. She was pale and sweaty and had to lie down. Now she's divorced her husband and she loves her life. She's lost 50 pounds and she goes to the gym every day and she just is flourishing. She is so happy, right? And I have story after story of people who take that really hard look inside and recognize, okay, how I'm living my life, how I'm showing up for myself is not how I want to be showing up for myself anymore.
We all have the answers within us. It's there. It's this little thing called intuition. And that is another thing that has been so suppressed and conditioned. And I used to say conditioned out of us, but it never leaves us. It's been so tamped so far down that we've forgotten that it's there. But it's all, we all have it. Men, women, we all have that. So it's about, I think that's part of it too, is learning to lean into it, sitting with yourself and taking the time to rediscover it and then relearn how to allow and trust it.
Yes. And the name of my project is called the Unforgetting Project.
Which we will talk about further in on the conversation because I'd love for you to share about that. You know, many physicians double down when something doesn't fit the model. You went the other way. That takes a lot of courage and maybe a bit of rebellion. What did you have to unlearn, speaking of, to begin to begin truly seeing your patients? Because that would have been a lot of unlearning after going to school for what, 7 years, 8 years?
But you know what? I didn't drink the Kool-Aid.
Very important to mention.
Very important to mention. I didn't drink the Kool-Aid. I didn't believe the things that I was taught. We're often taught, oh, these people are drug seekers and they're lying and they're just malingering. What? No, people don't want their lives to be crummy. They don't want to be in pain. They don't. It's a rare exception. That is the situation. Just because Western medicine can't understand why people have the weird, wacky, crazy symptoms that they do doesn't mean they're not true, right? So one of the most important things that I realized early on was that I had to believe my patients. I had to believe them. And even if I couldn't explain what was happening, I had to start with that premise that I believed what they were experiencing and that it was real and it wasn't in their head and all of those sorts of things that we like to say to patients. So that was probably one of the most important things, was that I believed them. And I've heard some really crazy symptoms, right? And as they start to understand what's happening physiologically with their bodies, they can start to gain more clarity about things. They recognize, okay, when I eat this food, I feel this symptom. And that's where we start. They're coming to me because I'm a physical doctor, right? I'm a medical doctor. So we're going to start with the body, which is super important. And I've always used my intuition. In fact, I use it every day with every single patient. And I teach my patients to lean into their intuition and to learn how to trust their intuition again. And I find the patients who are willing to do that, again, they get better.
Yeah.
Right? Why do they get better? Because they're being in alignment with themselves. It's not rocket science.
No. So I have a question then. So you said that you have to believe your patients. That's what it starts with. So is hypochondria real? And how do you disseminate, if that is real, how do you deal with that? Because that's a whole other level, right?
It is, but why do we assume that because they are anxious about their bodies? So what's happening with hypochondriacism is that people are experiencing symptoms. They don't understand them. They get anxious about them, and then they start to spiral. It doesn't mean that the symptoms aren't real. It means that there's a lot of anxiety around it. Because they believe that the body is against them.
Right. Okay.
So it starts with one of those foundational principles that I think is in question, is that if I believe my body is against me and I don't necessarily have control of it, and it's doing these things that make my brain feel really uncomfortable, of course I'm going to be nervous about the smallest thing, right? And oftentimes they will have trauma in their history. It could be trauma of watching a loved one get sick and have a terrible experience. But it all starts with not trusting their bodies and not having a healthy relationship with their bodies, and then not having validation that what they're experiencing is real or whatever. The way that I think about it and the way that I teach about it is the body starts out in whispers. And then if we don't pay attention, it turns up the volume a little bit. And if we continue to suppress and ignore or medicate or whatever, the volume gets turned up louder and louder until we absolutely have to pay attention.
Yeah. Beautiful. I love that. I love it. Sorry, go ahead. I didn't.
No. And so that's what happens with the people, is that the volume, they have a level of sensitivity, even though the volume is fairly low, that they're really anxious about it, most likely for traumas in their past or in their experiences.
Beautiful. Thank you very much for explaining that. I've always been curious about, because you always hear this word thrown around, hypochondriacs. And so I was very curious. So thank you very much for explaining that. I appreciate that. How did that shift then affect your identity as a doctor?
I would say that I got a master's in spiritual psychology when I opened my practice in 2008 in Southern California. And it absolutely informed how I showed up for my patients, how I listened to them, and for some of them, how I talked to them about this kind of mind, body, spirit connection. But it was few and far between. And then I just got more confident and more in tune with myself, right? So as I'm growing and as I'm recognizing things about my own body and the messages that I'm getting from my own body and what I need to do with them, I'm stepping in more fully and bringing that into the exam room with me and the conversations with patients. And I would really see the people who did this kind of work, who asked these sorts of questions of themselves, who were willing to look at, okay, what traumas in my life have really shown up for me that I need to address, right? Big traumas, little traumas. And everyone has trauma, right?
Yep.
This is why we forget, because we have trauma, but not because it's a bad thing. And here's the other piece that I think is really important is that in order for us to fully embody who we are on the planet, we have to forget who we are. We have to get lost, and then we have to fight our way back or find our way back using the clues and the messages that are being given to us through our bodies.
I absolutely love that. I love talking about this stuff. And when I get the opportunity to sit down and have conversations with women like yourself who are doing this work, I want to scream it from the mountaintops and the rooftops, because there are so many people out there. We don't know what we don't know. And so if we can plant seeds for people, having these conversations and educate them and put the information out there, what they do with it afterwards, that's up to them. But we're doing our part by having the conversation and sharing the incredible work that you're doing and how you're helping people, to let people know that you don't have to solely rely on Western medicine. There are other avenues and modalities that you can utilize to help obtain your ultimate health. And you're really, if we're healthy, my grandfather always said this, your health is your wealth. That's everything. If you could have all the money in the world, if you don't have your health, it doesn't mean shit. So you have to look after your body, which then enables us to achieve all the things we want to achieve in this world, and to know that anything that we put our minds to, that we set our minds to, we can achieve. Anything is possible. Anything.
Exactly. Yeah.
I love it. When someone first walks into your office after years of being told everything looks normal, what do you see in their eyes before you even say a word?
Oftentimes it's a little bit of trepidation mixed with hope. And yeah, I think they're there because they have hope. And sometimes I think about that little tiny sliver of what I call our remembered self, our authentic self, that's peeking through, that drives people to keep looking for answers, because they know it's not okay, right? They know things are not right. They're not fine.
Yeah.
Even though the blood work says they're fine, they're not fine. And so they keep seeking help because of that part of themselves that knows, right? And I think some of it depends on the person, but oftentimes the first thing I'll say is, first of all, I believe you. I believe everything that you tell me. And for some people, I read your entire story. I know what's going on. In fact, you don't even have to tell me your story, because I got it, right? And let's dive into how we get your body physically feeling better, and then how we start to move past that.
So would you say then, with a lot of your patients, the Spring Center is like the last stop for them? It's like they've exhausted all the other options, and okay, I'm throwing a Hail Mary here. I'm going to go see Kelly at the Spring Center, and this is my last ditch attempt kind of thing.
Sometimes. Yeah. Sometimes I've had patients who have seen a dozen to 3 dozen other doctors, practitioners. They've been to Mayo Clinic. They've been to some of the best and the brightest functional doctors out there too. And yeah, I hate to be the place of last resort, right? Because it's so much easier to start.
But it's also a place of hope too, though. That's pretty incredible that you get to help these people who are seeing your clinic as a last resort, but you get to reignite that hope and help them get better. So that's pretty amazing too on the other side of it.
Thank you.
That's really amazing. Do you think that modern medicine's obsession with suppression has cost us a relationship with our own biology?
It's a good question. I think I wouldn't blame Western medicine, right? Let's blame Descartes. It's his fault. I think, therefore I am. The body is a vehicle for, it's not Western medicine's fault. That's just the paradigm in which we see the world, right? Yeah.
Okay.
There were many thinkers along the way who got dismissed and overlooked, who were trying to fundamentally provide a different framework and paradigm. But Western medicine, Western culture kept choosing the mind is supreme, the body is flesh and weak, and we can blame the Catholic Church.
There's many, yes.
And it's not really blame. The other thing is, I really try and see that things unfold the way that they are, right? They just unfold the way that they're meant to unfold. I don't know if that's quite exactly right, but like I said, we all have to get lost in order to get found.
Yeah.
We have to come to a critical point looking at education, looking at medicine, looking at healthcare right now in this day and age. It's just like the same thing on a personal physical level with my individual patients. They get to a threshold where it's like, okay, I'm done.
Yeah.
I got to do something different.
Yeah.
Right.
For sure.
Here we are.
Yeah. Okay. What's the next steps? What do we do next? And yeah, absolutely. Now, holding both functional medicine and spiritual psychology in your tool belt, in your tool bag, how do you respond to critics who think those worlds shouldn't mix? Or do you even just ignore them? Don't even bother? As you said earlier, right? You're gaining you decided that I'm gaining my confidence in believing in what I'm doing.
Absolutely. I absolutely believe in what I'm doing because I see it in my clinic. I see it in the patients. What we're looking for, what we're all looking for, is love, self-love. That's where it all starts.
Yes, exactly. That we're the foundation. It's all here within us. This is where it starts, right here at home with us.
Right here, right? That's where it starts. And that's what the body's trying to tell you is like the choices that you're making, the coping mechanisms that you have, they're not in alignment with you living the life that you love. Stop it.
Plain and simple. Just like that. I always say this, that relationship that we have with ourselves is hands down the most important and longest standing relationship we will ever have in our entire lives. So look after yourself, love yourself. That's what it starts with, is love.
It does. But here's the thing, Brad, that we have to come at that place, not from here.
No.
And what I've found is that the way to that place of loving, deep connection is actually through the body and through the emotions, the unprocessed and unfelt emotions that are in the body, because that's how the body is holding on to those things that have caused us to forget.
Yeah.
And this is the difference between the body keeps the score and what I'm saying is that the body isn't holding the grudge. It's not against you, but it is holding on to the things, the beliefs, the patterns that we need to let go of. And in order to let go of them, we actually have to express the emotions of the sad little girl who didn't believe she was good enough or whatever.
Yeah.
The angry boy who is mad at his dad because his dad was a jerk or an alcoholic or whatever, right? So no matter how socially unacceptable our emotions may be, we have to feel them. In fact, and it's really interesting because science is actually starting to catch up and look at this. So there were a couple of studies, not a lot, but a couple of studies. One study looked at patients with fibromyalgia, and the control arm was cognitive behavioral therapy, and the other arm was a form of emotional expression. And the study arm that was the emotional expression, they didn't talk about their feelings. They learned to identify and express the previously unexpressed emotions. Guess what happened?
Healed.
Not 100%.
Worked, but moved towards.
But yes, 3 times greater reduction in pain in that group versus CBT, which is considered a gold standard talk therapy, etc. We can't get there with talk therapy.
No, because you're reliving the trauma. You're constantly reliving it.
Well,
it's
and
up
you're
here.
just up here. It's just up here, right? So you're not actually allowing the body to process it. And so the body has to process it. And what happens is when the body actually is allowed to express those emotions, what's underneath that is that self-love, is that peace, is that greater understanding, is that forgiveness for the parts of us that made the choices that we did because we didn't know any better. I find so much more love and peace and understanding, gratitude for the people in my life, myself, when I actually let myself feel those emotions. But you got to feel them fully, no matter how ugly.
Yeah, we're human beings. We are emotive. This is part of who we are. That's why going back to little boys, don't cry, stop crying like a little girl. You're so suppressing, hurtful. Yes, and you're suppressing those emotions that are in there, which then will, of course, manifest in the body in dis-ease, period. It's yeah. Thank you very much for sharing that, Kelly. I love that.
You're welcome.
What does it mean philosophically and medically that our illnesses are often ecological stories rather than isolated personal failures?
Ecological meaning like environmental? Yeah. So here's the cool thread that goes through all of this, right? So we were talking a little bit before about environmental chemicals and how we're all exposed to these things, and some of us more than others because of personal choices, right? But what makes somebody susceptible to the effects of the environmental toxins is based on their perceptions and beliefs about themselves. If I believe that I can only be loved if I am of service to other people, and I allow myself to be a doormat, how robust do you think my immune system is going to be?
Not very.
Not very, right? Because everything that I'm telling myself is I have to take care of everybody else. I'm not okay to take care of myself.
That's selfish.
I don't have any. That's selfish. I don't have any solid boundaries. Of course, that person's immune system isn't going to be able to discern what's me, what's not me. I should take all of this stuff, right? And that's a recipe for autoimmune conditions. If somebody is very afraid of a lot of things, like the world is scary, they don't grow up in a place where they felt they had a sense of trust and comfort, right? Their immune systems might be on high alert all the time. We call that Mast Cell Activation Syndrome, which I see a lot, right? Patients don't feel safe in their bodies.
Yeah.
Maybe they were told they weren't wanted. Maybe they were just neglected and they perceived that they weren't wanted. Therefore, the world isn't safe. They aren't really safe to be on the planet. Of course, they're going to have more susceptibility to exposures. So I think that they dovetail.
Okay.
They have to dovetail.
Yeah.
Right.
This speaks to exactly what you were saying at the beginning of our conversation when we're talking about the environmental toxins and whatnot. Why does it affect some people more than others? Why does it affect some people and not others? This is exactly why.
And the other thing I would say too is it affects people in a different way.
Yes.
Right. So if somebody was told, like men in particular are often told, don't cry, boys don't cry. What do you do with all that blocked energy of your heart, right? You make atherosclerotic plaque because energetically you aren't allowing the emotions to flow through your heart. So what might turn out in breast cancer in a patient who just gives and doesn't take care of herself might turn out as a heart attack in her husband. It's different pathology because of the different structure of the understanding that the person has of their soul and what their lesson is, right? So if they had listened when there were whispers instead of waiting until their screams, they might have been able to circumvent that.
Yeah. Yeah. It's just like the universe giving us messages. It starts with little pebbles, then it gets bigger with the rocks, then the boulders, then it's the 2x4 in the back of the head. You haven't listened all along. So guess what? Here it comes. Right?
Yeah, and it's very painful.
Yeah.
It's very painful when it escalates that way.
When you could have saved yourself all that trouble.
Yeah, we all have our own path.
Yep.
We all have our own journey, and sometimes people choose that's not the path that they want to walk on.
Yep, for sure.
And for myself, I have to respect that.
Yep, absolutely. 100%. What do you think would change if we replace the question, how do I get rid of this, with why might this be here?
So many things could possibly change, Brad. That would be amazing.
How do we get there?
With these conversations, right? And my vision for medicine, my vision for therapy is to really start implementing some of these very simple concepts in our way of thinking, and walking away from the old concepts that don't work anymore. They don't work.
Yeah. Kudos to you for doing this,
so
Kelly.
much money on that. Thank you.
It's needed. It is so needed. And it's funny because I'm meeting more and more women who are in this world of work, and it just shows that people are finally awakening and realizing, wait a minute, we could do things a little bit differently, which is absolutely incredible. And there's always going to be people that don't awaken to it, and that's okay. That's their path. That's their journey. But we can at least be here to support and help the ones who are awakening and who are just starting their journey. This is the whole hand up the ladder, hand down the ladder thing, right? Just
Absolutely.
This is what we do for each other.
There are people who are further ahead than I am, and I need their support. And and I'm a few steps ahead of other people, and that's who I'm here to serve.
I love it. It's incredible work that you're doing, Kelly. Truly amazing. I just love it.
Thank you. Thank you.
If healing is a remembering, what practices help people begin that return? Not as patients, but just as participants and in their own lives, humans.
Yeah. So the way in is when you have a trigger, when you have a sensation, when there is something with a charge, right? You, I don't know, get cut off in traffic, right? And you get irritated about it, which happens to me a lot when I'm not sleeping enough, right? So something like that happens, or you have one side of your body is more affected by something than the other. So you start to ask the questions, okay, what could this be telling me? What is the sensation? And then as you explore the sensation and really stay with the body, you will find that there's an emotion underneath that. So if I'm starting with a trigger, usually it's like, okay, there's an emotion. Where do I feel that in my body? Is it in my chest? Is it in my belly? And then you dive into that and explore, what is that emotion that's there? And this is the most important part, and probably the hardest part, because it's uncomfortable for us to actually feel those emotions. And we typically want to pop. It's almost like we pop out of the body into our head, into story, into whatever explanation. And you have to fight that urge to pop into story and stay with the body, stay with the emotion, and know that it's not going to last forever. I don't know if you've ever cried, but I'm sure if you have cried, it doesn't last forever.
It may last for a while, but
like when I find that when I'm doing this work, it doesn't last forever. It's like there's a wave and it's a couple 30 seconds, maybe 90 seconds, and then it crashes again. And underneath that might be something else. And underneath that might be something else. And so you just keep following the emotion until you feel that sense of clarity and that sense of resolution. And from that place, you have so much greater understanding. And that's where the love is, right? And so we can't change our lives
No.
willing ourselves to do things differently. We change our lives by expressing those emotions that are keeping us trapped in patterns that keep triggering us.
Very powerful. What do you think a healthcare system would look like if it prioritized prevention through environment, regulation, lifestyle, as much as it currently prioritizes intervention?
Yeah. At the beginning of COVID, I was so hopeful that the world could really start to recognize that we had such a great opportunity for changing, right? I remember watching the TV, and when young people would die, it would always make the news.
Yeah.
This 37-year-old gentleman and this 29-year-old woman, and it was terribly tragic, and that's how they spun it. But then they would show pictures. They were all overweight, almost all of them overweight. And I thought, I think there's something going on here, right? And now we know so much more about the cytokine storm and inflammation. And yet none of the powers that be said, hey, let's really try and clean up our diets and start exercising and doing all the lifestyle things that we could do to lessen our burdens and have them lose weight that way. But I'm not against pharmaceuticals, right? I'm a medical doctor. I use them in my clinic every day. And that's not the answer. Yeah, where does it start? I don't know. Our food is a mess. It's so fascinating. Many of my patients will go to Europe who can't eat gluten in many foods here. And then they go to Europe and they're like, it was fine. I could eat all the gluten I wanted, right? Why is that?
I just saw Mel Gibson talking about this, actually. He was saying he is in Europe, in Italy specifically. I can eat all the pasta I want. Everything's okay. And it's our food is being poisoned.
Our food is chemicals. It's not real food, right?
Yeah.
And that's acceptable. And then now we subsidize GMO corn and all sorts of foods that who knows what is going to do to people's bodies long term. Yeah, it's crazy making to me. And I live in a bubble. Most of my patients are very conscientious. They filter their water, they filter their air, they don't use plastic, they are careful with their personal care products, they don't cook on nonstick pans. You can make yourself a little crazy with all the things that we need to do. But yeah, I don't know how we change the system. I don't know.
Yeah.
Grassroots up is all I can think, right? Yeah.
Do you see physiology and psychology as separate influences on illness, or as one continuous conversation happening inside the body?
I think as we've talked, it's really one continuous conversation. Yeah. Yeah. It has to be.
Yeah. You use the phrase that symptoms can be, you've said this, meaningful messages that we need to listen to. From a scientific lens, what mechanisms actually support that idea? Like, where do we see evidence that the body adapts based on lived experiences?
Yeah, that's a good one. I think I'll have to take that one into my Consensus app and do some PubMed searching on that one. Yes. And I will have to say I haven't read Molecules of Emotion, but I'm sure that there's good stuff in there too. Yeah. I think there's information out there and it's becoming more readily available. And then the study that I quoted earlier is more a clinical application of that.
Some people, when they hear weird words like spiritual or woo, and they assume that we're abandoning the normal systems, the rigor. And how do you define spirituality in a way that is clinically responsible rather than abstract? I'm sure that the patients that come to you, they already know your background. They know that you're spiritually based and all of those things. But how do you deal with that for those that don't? How do you explain that piece of it? How do you define it for them?
If it's not of interest to them, we don't have to have those conversations. And I have patients who are like, yeah, using your intuition is against my religion.
Really?
Okay, good luck with that one. Yeah, like it won't let me use a pendulum, for example, to help identify what supplements would be most effective. Okay, all right, that's fine. And even with the Unforgetting project, I had some people who were nervous about it. there's nothing about this that is religious, period.
No.
There's really not even that much that's about God or the universe, right? It's more our relationship with ourselves. And if you believe that there's some part of you that is more than your thoughts and more than your physical body, and you call it something like spirit, soul, whatever that is, oftentimes it's as simple as saying, when you look at a dead person and you look at a live person, what's the difference?
It's
Right?
really
And
that
that's what I'm
simple.
talking about. It's really that simple. And that's what I'm talking about. So if you think that you're the same as a dead person and there's nothing that enlivens you, okay, then we don't have to have this conversation. And even science is not really great at, they don't like this idea of life force energy, right? That's too woo-woo for them. But okay, there's something that's driving those mitochondria, and it can be air and water and but how do you get the electricity? Like, so at some level, it becomes a little silly to me that you have to prove that there's something different between me and a dead person. I don't know.
You're not my people. Forget it. I can't help you.
So I can't help you if you think you're equivalent to a dead person. No, I'm not being disrespectful.
No.
I'm really trying to make it as simple as possible. Most humans on the planet recognize that there's something different about somebody who is living and somebody who is dead. And that part of us that is more than our neural connections, our intuition, our internal sense, our internal knowing, that's what we're talking about. That's what I'm talking about, is cultivating the relationship that you have within yourself already.
I can't believe someone said to you that trusting their intuition or intuition is against their religion. You have it in your body. It is in you.
I should probably clarify. So I happen to sometimes use a pendulum because I'm busy and I'm trying to figure out multiple things. Sometimes I'll get a physical sense like, okay, this is what I need to do, or I'll hear a word in my head. Okay, that supplement. But when I'm trying to help somebody in a really short period of time and get a list of supplements that I think are going to be most effective for them, or medications that are going to be most effective for them in the right order, I don't have the time to be like, okay, I'm going to go meditate for 20 minutes and figure this out and I'll come back. So I use the pendulum to help facilitate that process. And I've had patients say, can you please not use that? That's against my religion. Okay.
All righty.
We'll do it the old-fashioned way. You'll start with this one because that's the one that everybody starts with, and you get the protocol rather than something that is personalized. And if you don't get the results that you want as quickly as you want, then maybe you can rethink that.
Yeah. Okay. This is what you want. This is how you want to play it. All right.
Yeah.
So this is a perfect segue into the Unforgetting Project. You mentioned it. Please share all the things, the Unforgetting Project.
Yeah, so this is my baby, and this is why I'm here on the planet. So as I mentioned, the Unforgetting, identifying all the things that are not truly us, all the beliefs, all the misbeliefs, all the misinterpretations, all the misunderstandings, all the things that we have taken on that then lead to coping mechanisms that lead us to the point where we're not really being authentically ourselves. The Unforgetting is getting back to that authentic self. And in my paradigm, we call it the remembered self, a 9-week foundational program.
Okay.
9 weeks is a very auspicious duration of time. Many spiritual traditions throughout millennia have used 9. It's a sacred number. And what we do in that is practice a variety of different ways in feeling those emotions and also framing the whole paradigm about safety, about love, about forgiveness. And it's this beautiful container of people, and it's a live class. And it's a participatory class. It's just, you have to actually show up and participate in that. every single class we break folks into trios. So there's three people, and they each have a role. One person is the explorer, so they're the ones actually doing the emoting, hopefully. One person is the companion, and they are, imagine that you were playing a game with your friend, and one person is blindfolded and the other person is like holding their elbow and making sure that they don't trip on the roots or whatever, right? So that's the companion. They don't necessarily know more, but they have the sheet in front of them so they can read and make sure that the explorer doesn't get lost or turned around or stuck in story. And then the third person is actually the anchor, and they do not participate with speaking. They're just holding the container of loving. And then there's generally a process that they're working on, and then they switch roles. And so in every trio session, each person participates in each chair. And in that way, they get to experience themselves and each other in a really deeply loving way, because people are very vulnerable. And one of the things I learned a long time ago was that vulnerability allows for intimacy.
For sure. And relatability.
And relatability, absolutely. So that's the foundational program. And from that, we are now developing a membership. And I also do what I'm calling Unforgetting journeys, where people who want to take a deep dive. I love therapy and therapists, and I've benefited greatly from therapy throughout the years. But it's like, okay, it's 15 minutes, time's up, gotta go. I know you're like broken down and sobbing, and but we gotta wrap it up.
Time's up.
Time's up. I don't do that in the Unforgetting journeys. We go for as long as people need to go. And it's not really therapy. It's not somatic experiencing. It's not anything that I've really seen other people do. I had one woman who was a therapist for 10 years, and she said, "Oh my gosh, Kelly, this is the most amazing thing I've ever experienced. I've never seen anything like it, and it needs to be in every single therapy curriculum around the globe."
Wow. Whew. You know you're doing something right. That's amazing.
Yeah. And so, we just go into the emotions, go into the body, figure out what's there. And in experiencing those emotions and staying with those emotions, things clear. I don't know how to explain it, except that it clears, and we go until they feel complete for the day. And usually they'll know, I have more to do, but I'm complete for today. And it could be 2 hours, it could be 4 hours.
Wow.
Really do. Yeah. These are intense.
No
These are intense sessions. But I had a woman a couple weeks ago. She has a seizure disorder. She recently had been in a car accident, and she was incredibly anxious. She could barely drive to the office. She was so anxious about getting in another car accident and just really nervous about things. And when she was having terrible migraine, debilitating headaches. Headaches are gone. Anxiety's gone. In one session, 3-hour session.
That is incredible.
Yeah. So much healing can happen in a really short period of time. We have this idea that healing takes time.
Says who?
Healing takes time to shift our consciousness.
That is powerful. We'll put all the links for all of this incredible stuff, as well as your website and all of that stuff, in the show notes when we release your episode. That amazing. The Unforgetting Project. And then, I love it. Beautiful. Thank you so much for sharing all that, Kelly.
You're welcome.
You have been involved with and done work with the American Academy of Environmental Medicine and the International Society for Environmentally Acquired Illness. Are we beginning to see momentum toward this broader understanding, or are we still in the very early edges of it all, do you think?
When I look at my Instagram, and I'm sure that my Instagram is not like a lot of other people's, but there's definitely more people out there, more influencers out there talking about environmental chemicals. The problem is that's influencers. That's not necessarily physicians, practitioners who really know how to treat these things. And so the public is becoming more well educated about their personal care products and plastics and pesticides and things like that, which is fantastic. We absolutely need that. And we also need more and more practitioners, naturopaths, medical doctors, people who are doing functional medicine to stand up and start to communicate this. And then I think part of the challenge is I have a full busy practice and I'm on a couple boards and I'm doing the Unforgetting project and these Unforgetting journeys and I want to write a book and I don't have time to be an environmental advocate.
Right.
Right. Which is really a piece of the puzzle that is absolutely needed, is somebody to start to build momentum to make changes and lobby, et cetera. And I know there are certainly some people helping with that. Like Aaron Brockovich is a huge proponent, obviously, of environmental changes. But there's so much work to be done.
There is
so much work to be done.
There is. And you're only one person. Like you said, you have so much going on. You can only do so much, and you need to be intentional about where you put your focus and your energy. And when you do that, though, that also does open up the lanes for those who are experts or want to put their energy into those areas. That gives them the space to do it as well, by you focusing on what you need to focus on and your patients and your work and the Unforgetting journeys and all of these things. So we all have to do our part, all of us.
Exactly. Yes. And I'm sure that there will be people out there who are far better suited to do that than me.
Do you think modern medicine has underestimated the physiological cost of disconnection from nature, from community, and again, as we've mentioned time and time again, our own intuition?
I don't think that Western medicine has a lot of awareness.
We'll just leave that there.
As a paradigm, as a institution, it is not interested in growth and transformation, period.
That's very sad. That is very sad.
It is very sad. It is very sad. I remember my mom was in the hospital a couple of years ago, and she had a urinary tract infection, and they gave her IV antibiotics, but cognitively she wasn't any better. I would walk into the room and she wouldn't even smile. Okay, there's something really wrong. My mom loves me very much.
Yeah.
The fact that she's not smiling tells me there's something really wrong. And I actually got her transferred from one hospital to the hospital where I'm affiliated. And I tried to talk to the hospitalist, like, hey, there's this test that looks, so the gold standard for a UTI, right, is a culture.
Okay.
They literally take the urine and they put it on a Petri dish. You remember Petri dishes from high school biology? So that technology is centuries old. In the world of AI computing and cryptocurrency,
we haven't advanced.
That's our gold standard for identifying an infection in somebody. And if you have some bacteria, but not a certain threshold, right? If you don't meet the threshold, you don't have a UTI. Okay. So I'm trying to explain to this young hospital, there's actually more accurate technology out there called next generation sequencing, which is where we don't put it on a Petri dish. We look for the DNA in the specimen and we identify every single organism that's in that, because guess what? Most of them are polymicrobial, meaning there's more than one organism.
Okay.
My mom had Candida in her bladder. Candida is a fungus. When you give people antibiotics, sometimes women often get a yeast infection in their vaginas, right?
Yeah.
Hers was in her bladder.
Jesus.
Which you never would have known about had we not done this specific test. And so 4 doses of an antifungal and she's back. Oh, hi, I'm so happy to see you. Really? So imagine, and I could not get this young doctor to understand this technology, which is not rocket science. He was like, what's the threshold?
Yeah.
There is no threshold. If you have an organism and you have symptoms, you have a problem.
Yeah.
Okay. So, yeah, Western medicine just doesn't get it. And thank God for that test, because
no kidding.
My mom came back, right? Imagine, I just think about all these little old people in nursing homes and rehab centers who don't cognitively recover from a medical issue. and how much we're probably missing. And then they get the dwindles, and then they fall, they break a hip, and then it's game over.
The spiral. Yeah, for sure. It's crazy.
It's so sad that even something as practical and obvious is not being widely embraced by conventional medicine.
Unbelievable. Do you think the next revolution in medicine will come from new pharmaceuticals or from a redefinition of what healing actually means?
I hope it comes from a redefinition of what healing means, and I intend on being part of that vanguard.
I love it. So you founded the Spring Center. Tell us all the things Spring Center.
So the Spring Center is an amazing place of healing. It is a small practice, fairly boutique practice. I have 2 other practitioners who work with me, as well as an IV specialist and a team of phenomenal staff who adore the patients, and many of whom are on the whole Unforgetting project team with me and exploring that. So they're just really loving human beings. And when you walk into the space, it's in a 19 medical office space in Orange County in a residential area. So there's homes all around, and it's just this little oasis. It's such a sweet little place with lots of light, and I have a fountain right outside
Nice.
I have a sliding glass and a fountain right outside. And it's just so special. The kinds of patients that we see now are, as I mentioned, complex chronic illness. So I see a lot of mold patients. I see a lot of Lyme disease and chronic infections, mast cell activation, autoimmune conditions, mostly adults, although I am a pediatrician. I don't see a lot of kids, but it depends on the situation.
Right.
Like I'll have families who have been mold exposed, and I'll take care of the parents and the children if necessary. Yeah.
Beautiful work. I love it. That's it. It is about the environment that you create as well, where you practice your work. Having, as you said, to use your word, an oasis where people feel good when they walk in. I love it.
Yeah. Yeah, it's so much fun to walk into the IV room in the afternoons where there are a bunch of people getting their IVs and they're chatting, having a good time. It's like a party in there, right?
Party.
It's an IV party. Or in the waiting room, and there'll be new patients who are nervous because they're first coming in, and there's existing patients, and like, oh, you'll love it. It's amazing. And the patients walk in and they're greeted by their name, and we know their dogs' names and their life stories. And that's not just me as the practitioner or other practitioners, that's the staff. And it's really a joint effort to take care of these amazing patients.
That's incredible. I love hearing that. When you imagine the future of health, not just medicine, but humanity, what responsibility do each of us carry that we can no longer outsource to practitioners, prescriptions, systems?
Oh, yeah, we got to be responsible for ourselves. And that goes for everything, not just our physical bodies, but what we feed ourselves, both in terms of food and in terms of our thoughts, how we allow our thoughts to guide or derail us, and really cultivating that internal intuition. I think that's super important. And recognizing that you are always the most important person in your healing journey, and that no doctor, no practitioner should have supremacy over your own understanding of yourself.
Beautiful. If every listener could walk away with one question to sit with after listening today, not to answer immediately, but to live into, to feel into, to embody, what question should that be, you think?
Are you living the life that you want to be living? Are you living a life of joy, of passion, of creativity, of authentic expression? And if not, what might need to change?
That's a powerful one. Thank you for that. What do you think your unique skill set or superpower is that's helped you become successful, Kelly?
I think it's a number of things. I think it's patterns. I'm able to see patterns of where blockages might be, where opportunities might be for shifting and healing. When I do these unforgetting journeys, I have no idea where they're going to go. And yet sitting with people, whether it's in the clinic or on these journeys, like I'm present for the ride with them, and I'm able to help and support in a way that feels very natural to me and ends up being almost always exactly what they need. And that's pretty powerful to be able to be so open to my own internal wisdom that I can be that conduit and be that support for them.
I love it. How do you define success?
Success is when you feel like when I feel like I have helped people in a way that uplifts them, when I'm in alignment with myself, when I feel that sense of loving and peace and anticipation of what's next.
What does the word empowerment mean to you?
Empowerment. I think it's stepping into our own authority and embodying that.
That's powerful. Okay, we're going to jump into a little rapid fire section. So the next great questions will just be...
All right, let me take a sip of coffee. Hang on. My decaf coffee, I pretend.
What is your favorite way to celebrate?
Oh, favorite way to celebrate? Probably having a glass of wine.
I think you need to do more of that then. One word to describe your 2025.
2025, intense. 2025 was very intense.
If you could teach the world one thing, what would it be?
Be yourself.
One book that changed your life.
We can just go with The 4 Agreements for now.
I knew that was going to be the one. You told it because you mentioned it.
There are a lot, but that's the one that came to mind most clearly right now. Yeah.
If you could be remembered for one thing, what would that be?
Oh, it would be the Unforgetting Project. And the person who started the conversation to change the way we look at health.
What is one thing you love about yourself that is not related to your physical appearance?
My compassion.
What is one word that defines the woman you are becoming?
Authentic.
That concludes our rapid fire section. Now back to our regularly scheduled program.
Phew. Okay.
We're good. You did good. I created a bonus question that I did not send you ahead of time. How do you define love, both the kind you give and the kind you receive?
I think love is, I feel most love when I am residing in who I really am. It's just like being okay with who I am and where I am and sharing that with another person.
If you could step into my shoes, what is one question you would ask yourself that I didn't ask you?
Oh, yeah. I read that one. I forgot to think about it. Let's see. What would I ask me? What's next for the Unforgetting Project?
Okay, go ahead.
I think this is a grassroots movement where people who are called to do this internal work find answers for themselves. And my hope and expectation is that the people who are called then become the people who will teach this. And the next levels, I have this foundational program for people. And as soon as this concludes, I will be working on level 2 and the podcast, What's Next. But it's also about teaching practitioners how to hold this presence, how to be with themselves differently so that they can show up for their patients differently. Many of my patients come in and they have been gaslit and they're distraught and traumatized by the medical community and what they've experienced. And I think that this is a way to really shift that consciousness for practitioners who people don't go into medicine to make money, right?
No.
Not with the amount of sacrifice. Oh my goodness. And lack of sleep.
Yeah.
People go into medicine because they want to help people. But I think that desire doesn't really go away. Western medicine doesn't have the tools. Functional medicine doesn't have the tools, right? How do you show up for somebody if you don't know how to show up for yourself?
Very true. Very true. That is a beautiful vision and beautiful work, Kelly. Beautiful.
Thank you.
If you had the opportunity to sit down and have a 1-hour conversation with one woman, any woman in the world, who would it be and why?
I did think about this one. Probably, yeah, if I can get 2.
Sure.
I would love to sit down with my grandmother, probably both grandmothers. I grew up with one, my mom's mom. She lived in our house for many years. She died when I was probably 22, something like that. And my father's mother died when he was 8 or 9. So I got to meet her. Mother Teresa, maybe. Oh gosh, there was another woman. I forgot her name now. I should have looked it up. But she's still alive. She had lymphoma and died and was in a coma and had an NDE and has since come back and shared about her life. And she came back healed, completely healed.
Incredible. That's amazing. Yeah. That would be an amazing conversation.
Yes. She's a pretty powerful person. And I'm so sorry I can't remember her name off the top of my head. No. But yeah, I'd love to sit down and talk with her.
Yeah. If you could go back and give your younger self one piece of advice, what would that piece of advice be?
Know that everything that you're going to go through is for a reason. And you're going to be okay.
Beautiful. Lastly, Kelly, if you were to deliver your last 30-second speech to the world, your tribe, your corner of the world, your people, what would that last 30 seconds sound like? What words of wisdom would you impart?
I used to say there's always hope, but what I would probably say now is that you are your own hope. You are your own love. You have the power within inside of you to create what it is that you want in your life.
Beautiful.
The hope isn't out there. The love isn't out there. It's in here. And it's already always been yours.
That is powerful and a beautiful way to end the interview. Kelly, thank you so much for showing up and shining, for sharing the beautiful light you put out into the world, the incredibly important work you're doing and the people you're helping and your story, your journey. I have enjoyed every minute of our conversation. We went so many places and I just loved everywhere we went. Thank you for being open to going in all the different directions and for sharing your work. And you are truly an inspiration, and the work you're doing is incredibly important. So thank you for taking and making the time to be here and inviting me in to share in your story and your journey and allowing me to be part of it. I appreciate you. I am grateful to call you a friend and to have you as a member of the Empowerography community.
Thank you so much, Brad. This was great fun. I really appreciate you too.
Thank you. I received that. Once again, my name is Brad Welsh, host of your Empowerography podcast, a platform that was created to help elevate and amplify the voices of women through sharing their stories. Today, my guest has been Kelly McCann. She is a triple board certified physician in internal medicine, pediatrics, and integrative medicine with additional certifications in functional medicine and medical acupuncture. She is also the founder of the Spring Center in Costa Mesa, California. Thank you so much, Kelly. I hope you have a beautiful rest of your day.
Thank you, Brad. Bye, everyone.
Bye.
Thank you very much for listening to this podcast. If you haven't yet, please be sure to subscribe, rate, review, and share with all your friends. You can find me at visuphoria.ca, follow me on Instagram at Empowerography Podcast, and on Facebook at Empowerography. Please join me next time for another inspirational story from yet another amazing woman.